Okay, so we've just had a little swap out of speakers again, but I do want to give a bit the floor to Paul, who actually many of you may know or may not know, but Paul is our current education lead for Cornwall. We're really lucky in Cornwall that we received some health social care kind of funding to run a dementia education programme. And we keep championing. And again, that was feedback from the Hear Our Voice report, that people living with dementia and their carers felt that health and social care, people didn't know enough about dementia, that they were coming across people that didn't really know how, what it was about, and awareness raising. So we're really lucky, and Paul's multitasking. Look, he's one off to do this, the ramp. So we're really lucky to have Paul as education lead, but also in his role, he has been a Trojan behind the scenes, organising and sort of pulling together today's conference with the backing and support of Kernow CIC. So Paul's going to do a little plug and give you an update on where we've got to with our education programme in Cornwall.
So there's lots of things about dementia education. We've got lots of plans for the next 3 years. So we're going to GP surgery by GP surgery, and that's not just to talk to the clinicians. We want the admin staff, and we get them all in one room. And what we do is we speak to them half and half. So I'll go through what you call your tier 2 dementia training. And this is what is available to everybody. Like, it's all free. But if you're a carer, we would just direct you to ProMass. We would take anybody else. It covers the criteria of health and social care for staff, but we'll take anyone onto the course. If you work in Tesco garage, all the way up to a consultant. If you worked in the Royal Cornwall Hospital, recently it's been added on to the mandatory training for clinical and like face-to-face staff, and the training rate has gone up from, I think it was like 900 in January to 1,700 4 months later, just because I'm seeing it up here, I need to do the training. So we wanted to push that out. And it's, as I said, we try and bounce about. So each month we're in a different location. And that tiny QR code is that QR code there. So if you wanted to find out where's local to you, scan that and it will just say where's going, where are we next? And I can't remember where we are next. Where are we? June, we're in Lifton. And then, yeah, July, Chasewater. So we try and move about. We're going to try and do an online session, and we're going to try and get out to the Isles of Scilly one day. Indeed. It'd be nice, wouldn't it? The other thing I'd like to push as well, so this is kind of called, you got your tier 1, your tier 2. There's also, for people who really want to drive their dementia training, I've got a list of all university courses. So if you really wanted to go through like what you call it, a level 6, level 7, so university driven, we've got a brochure on the website as well that you can just look. So you've got Plymouth, because it's quite easy to get to, but every other one is virtual training. So you don't have to do it physically there as well. Any questions on education, do come and find us. We're now going to split to do the workshops. Okay. Now, sadly, due to ill health, because you won't notice that I'm not on the agenda. Sadly, due to ill health, we're not going to do the next talk, and we've only got the Alzheimer Society doing Dementia Friends, and we've got Kelly doing Sleep Better, Feel Better. Oh dear, Kelly, I'm sorry. I hope that's right. No. So we do not have the Falmouth Art Gallery doing their Cogs and Curiosities, sadly. So what we'll do in the front half of this room now. If you signed up to do Dementia Friends, come to the front half of the room. If you did Sleep Better, Feel Better, go to the rear half of the room. If you chose to do the Falmouth Art Gallery, you have a choice. All right? You can choose. All right, give us a couple of minutes. We're going to spread the walls down now, okay?